This presentation will discuss the electronic Delaware Medical Orders for Scope of Treatment form and the online registry found at din.org. Advanced care planning is a process of communication that changes throughout the lifespan. All adults should name a power of attorney for healthcare and discuss their wishes for medical or surgical treatment in the event that they cannot communicate these wishes. These discussions should include the patient and their healthcare staff, but should also include the patient's healthcare power of attorney and their family. End-of-life decision-making includes forms like the POST, Physician Orders for Life-Sustaining Treatment. A legal adult who has decision-making capacity may choose to refuse any medical or surgical treatment as long as that refusal is not contrary to any existing public health laws. This includes refusing treatment and allowing a natural death. Although it is recommended that all adults have a living will, this document is difficult to apply to specific situations and is therefore difficult to direct care at the end of life. It must be translated into medical orders. Assigning a power of attorney for healthcare alleviates this situation and allows a person to make on-the-fly decisions for a patient based on that patient's previously discussed wishes. Neither a living will nor a power of attorney for healthcare are consulted unless a patient has lost decision-making capacity or is otherwise unable to make their decisions known. All adults are presumed to have decision-making capacity. Only a physician may determine if a patient has lost that capacity, and that determination must be recorded and communicated to the patient. At that time, another person must be designated to make decisions until such time as the patient regains capacity. This representative should be the patient's previously chosen power of attorney for healthcare. The representative may also be a guardian as appointed by the state or a surrogate. The Physician Orders for Life-Sustaining Treatment form, or POST, have been adopted across the country in every state. This type of form has been found to be more effective at aligning patient preferences with the type of care they receive near the end of life than traditional advanced directives. The Delaware version of the POST, the Delaware Medical Orders for Scope of Treatment, or DMOST, is aimed at persons whose healthcare provider would not be surprised if they died within the next year. The National POST paradigm intends these forms for patients who are considered to be at risk for a life-threatening clinical event because they have a serious life-limiting medical condition, which may include advanced frailty. The DMOST is a voluntary form that follows the patient through transitions of care. It is clear, standardized medical orders and is immediately actionable upon the completion of the form and the signatures of the patient or their representative and the healthcare practitioner. There are differences between traditional advanced directives and the DMOST form. The DMOST form is kept with the patient or in an online registry and is medical orders. An authorized representative can also make changes to a DMOST form if a patient has lost decision-making capacity and has previously given their permission to do so. All members of the healthcare team may recognize, honor, or help complete a DMOST form. Only a physician, physician assistant, or advanced practice registered nurse may execute a form and sign it into medical orders. In order to initiate a DMOST, the practitioner must not be surprised if a patient were to die in the next year. The form can be introduced by any member of the healthcare team, including the patient, their authorized representative, or their family. Using the form, the patient and healthcare provider can discuss the patient's goals, wishes, and treatment preferences. Afterwards, the patient, or their authorized representative, and the provider must sign the form. The DMOST form was originally only a paper form. Paper forms are acceptable in all healthcare institutions in Delaware, but must have a visible watermark, internal consistency, a completed signature section, and no additional markings in order to be considered valid. The DMOST form is completely voluntary and may not be a requirement for admission into an institution or healthcare benefits agency. If a section of the DMOST form is not completed, full treatment is assumed. Comfort measures will always be provided. A DMOST form cannot be modified. If a patient's preferences change, the form must be voided and a new form created. The DMOST form can be voided at any time. It is considered negligence to intentionally ignore or destroy a DMOST form, and not honoring a form can lead to a felony or a loss of license. All healthcare institutions in Delaware are encouraged to have processes in place to recognize, honor, and store a DMOST form. The 6 sections of the DMOST form are the same for both the paper and the electronic form. If any section is not completed, full treatment is assumed. The electronic DMOST form can be found on the Delaware Health Information Network website, DIN.org. This presentation will cover how to access the online registry, look up an existing DMOST form, void an existing DMOST form, complete a new e-form, and upload that form to the registry. It will also cover how to print out the form and frequently asked questions for patients and their families. To access the online registry, go to DIN.org and select Healthcare Providers, then scroll down to DMOST Registry. To access the online registry, go to DIN.org and select the Healthcare Providers menu, then choose DMOST Registry. To access the registry, scroll down the page. You will also find a PDF of the DMOST form and frequently asked questions. Click the link to the registry and input your username and password. In order to look up a patient's existing DMOST form, the first step is to find the patient in the DMOST registry. Input as much demographic information as you know and hit search. If a patient has a DMOST form in the registry, their name will appear, and you will be able to see their current form as well as any voided forms the patient had previously. This patient does not have an active DMOST, but she does have an incomplete form waiting for a healthcare provider signature. In order to create a new form and thus void the old form for this patient, all you have to do is select Start a New DMOST. The E-DMOST will take you through the same sections as the paper DMOST. The first section you'll come to is the Goals of Care section. This section outlines the specific goals of care that a patient is trying to achieve. This is not medical orders. Use this section to help guide the patient's answers for the rest of the form. The following sections have logic built into them. So if you say, we're going to attempt CPR for this patient and accept it and continue, the only thing that you can choose in the next section is full treatment. This is internal consistency of the DMOST form and has to be there in order for the form to be valid. If, however, you choose DNR, do not attempt, and go forward, then you can choose the other options. Another option in limited treatment is transferring to the hospital for certain medical interventions, and you can also choose comfort-only measures. You can put other orders in here too, like dialysis or blood transfusion orders if needed. In this section of the DMOST, you can discuss with your patient whether or not they would like any artificial hydration or nutrition. There are also options for defining a trial period for this type of care. In this section, you need to identify the people participating in the planning discussion. At the very least, even if they do not have decision-making capacity, you should be talking with the patient. Their authorized representative should also be present. This representative can be the patient's power of attorney for health care, their surrogate, or their guardian appointed by the court. It may also be the parent of a minor child. Next, you put in who the authorized representative is and their relation to the patient. And again, in this case, the street address will automatically start filling in once you start writing it. At the bottom of this section, you're going to ask your patient if they lose capacity, if their authorized representative has the ability to change or void their DMOST form. Depending on what the patient says, you're going to choose whichever option. And now we come to the patient's signature about whether or not their authorized representative may change the form. So you can either click to connect to a mobile device, an iPad, an iPhone, or an Android phone, or an Android pad of some kind, or you can have the patient sign with the mouse on the screen. And you accept and continue. If you choose to have your patient sign by way of a cell phone or tablet, click the link on the E-DMOST that says, "Click here to connect to mobile or cell for signature." Your device will receive a text message like this one. Click the link within the text message to connect your device. You will receive a 6-digit confirmation code on the device. Input that code into the E-DMOST pop-up window. You will see a box on your cell phone or iPad that says "Sign your signature here," and you can just do it with your finger, and that signature will show up on the screen wherever you're filling out the form itself. Next, the person preparing the DMOST needs to fill out their information. In this example, the preparer is signed into the registry as a nurse, social worker, member of the clergy, or any other member of the healthcare team. They select their name, and they put in their phone number, and then they can sign either via a mobile device or with the mouse. Now, if you're on with a mobile device, then that is going to continue to be accepted. You don't have to keep doing it every time you need a signature. The next person to sign is the patient, and you can do it via the mobile device that you've been using or with the mouse again. And you'll notice that the date that the patient signs automatically fills in. So accept it and continue. And because this person, whoever they are, is signed in as just a preparer, not a provider, you're going to get this error message. So the preparer has done as much as they can do. So you can either stay on the page and double check that you've got everything going on that needs to be done. You will be asked for more patient information just to make sure that the patient is who they say they are and you have the right patient with the right form. But you will continue to get this if you try and go on any farther. So for the preparers, their job is done. In order for the DMOST form to become executable, a physician, APRN, or PA must sign it into medical orders. This is the final signature needed on the electronic form. So the physician will fill out his or her information, and you have to put in your license number. And again, if you're using a cell phone or other mobile device, you'll still be able to sign in, or you can sign with the screen. Now let's say that you're pretty sure that you have a patient who doesn't have a DMOST form on the e-registry, or you have a patient that you know doesn't have a DMOST form. Again, you're going to put in as much information as possible about the patient to make sure that there isn't anybody already on the registry with that name or with that information. If no patient is found, you simply have to add a new patient, and you put in as much information as you know. The street address will automatically fill in when you start to type. And all of this information is so that DIN can make sure that they are matching the correct patient with the correct forms. Once you've added your new patient, there's obviously no active DMOST found, and you can start to create a new one for him. Once you've finished creating the E-DMOST for your patient, you can go onto their dashboard, and the first thing that you see is the main things that they do or do not want. So in this case, we do not resuscitate, we only want comfort measures, no nutrition. And you can see the current DMOST form as well as any prior DMOST forms that the patient may have had. If the patient decides they want to void the old form and make a new one, all you have to do is hit Start a New DMOST Form and it will take you through the process again. If the patient, however, wants to void their form and not make a new one, there is an option to void and remove the form here. This form here can be printed out and given to the patient along with their frequently asked questions. All users that are assigned the role of either signer or preparer will also have the ability to upload paper DMOST files. To upload a paper document, first sign it to a computer, then sign into the DMOST registry and search for the patient. If the patient is not yet in the registry, add them. Once on the patient's advanced care planning dashboard, simply choose to drag or browse a document to upload. The registry will perform several checks to ensure the paper form and the patient match, but then your paper form is on the registry. The DIN recommends that an organization upload their paper DMOST files. All users with the role of signer or preparer will have this ability. If you have any questions or concerns about the upload functionality, please contact the DIN service desk at 302-480-1770 or email servicedesk@din.org.